Hello everyone. From today, we will launch a series of introductory lectures on OCT. Today is the 5th lecture of the course, where we will introduce optical coherence tomography and the image interpretation. I am Dr. Kong Ling Kui, PhD, from the Department of Cardiology at Zhongshan Hospital, Fudan University. Finally, regarding intraprocedural and post-PCI imaging, we should also examine the stent's morphological features. This is an intimal dissection visible here. It happens at the stage of pre-stent implantation, following the balloon angioplasty. In some patients, plaque rupture may occur and lead to dissection. All these scenarios are possible. Therefore, during the procedure, we must carefully identify these conditions. If dissection is present, excessive contrast injection should be avoided, as it may lead to severe hematoma. Additionally, stent malapposition will be specifically addressed later, with dedicated and further explanation. Overall, there are 2 assessment criteria. First, the distance between stent struts and vessel wall should be within 200 microns, while overexpansion, in some patients, may cause tissue prolapse, which adversely affects patient outcomes. The second criterion compares the distance between stent struts and the intimal surface with the thickness of the struts. If the distance exceeds the strut thickness, it also indicates stent malapposition. The second standard provides broader applicability and better clinical utility, as it facilitates easier detection. The strut thickness of the current stent platforms are typically around 100 micrometers. Therefore, in clinical practice, optimal apposition generally requires the distance smaller than 100 micrometers. However, it often requires aggressive post-dilation to achieve this standard. Otherwise, the stent apposition might not be good enough. As for OCT, it does help identify such issues. IVRS, on the other hand, is less effective when compared with OCT, because when IVRS encounters highly reflective stents, the acoustic signal gets scattered. It can't penetrate metal stent to observe the full thickness of the strut. So, if you want to measure the strut thickness, it's quite difficult for IVRS. Thus, measuring the distance from the strut to the intima is even harder. IVRS can only assess based on the stent's shape, whether it's elliptical, etc., or evaluate the lumen area. So IVRS is not as precise as OCT in stent apposition evaluation. That's all for today.